Hi everybody, so we're going to talk about dosage calculations in this segment. We're going to get into some story problems and how to tackle these dose over hand issues. So here we go. IV bag 1000 mLs. Solution was administered and now has 400 mLs after a 5-hour infusion. How much IV fluid did the patient receive each hour? So our first step, what we want to do is take the total amount that was in the bag, which is 1,000. And then we're going to subtract what's left over after this 5-hour infusion, which is 400, which is going to give us the amount that was infused, which is 600. We are then going to take that number, 600, divided by the 5 hours, and get 120 mLs per hour. Now this number is actually indicating how much fluid was infusing per hour, a total of 600 at 120 ml per hour. And if you want to check yourself, you can always go back and do so. If you do 120 times 5, you should get 600. Next problem. The physician ordered chemo for a 55 kilogram patient. What is the daily dose if the order is 16 milligrams per kilogram per day? So luckily in this question, the question actually gives us the patient's weight in kilograms. So we don't have to do any conversion here. We're already in kilograms. So we're going to multiply 16 milligrams times 55 kilograms. And we're going to get 880 milligrams per day. That is going to be the daily dose for this patient. Always remember to check your units of measurement. We have here 55 kilograms. And if this was a problem where we would need to convert and the patient's weight was in pounds, we would need to divide by 2.2. That will be the conversion. Always remember, 1 kilogram is 2.2 pounds. So this problem here says a med order calls for a drug to be given every 6 hours. The patient takes the first dose at 8 a.m. What time will the patient take the next 2 doses? So all we're going to do is start at 8 a.m. and we're going to go up 6 hours. So 8 a.m., 6 hours up will give us 2 p.m. Another 6 hours up will give us 8 p.m. So the next 2 doses will be at 2 p.m. and 8 p.m. Okay. So in this problem here, it says that the patient is having some difficulty swallowing tablets and her doctor orders her an oral suspension that comes 25 milligrams per 5 ml of indomethacin. For a dose of 50 milligrams, how many teaspoons must she take? So we're going to do some conversion here. The first thing we're going to figure out is how many teaspoons to how many mLs. So 1 teaspoon is 5 mLs. So we know that for every 25 milligrams, that is 1 teaspoon. So if she's taking a dose of 50 milligrams, that would be 2 teaspoons. Considering 25 is 50. This problem says a patient takes 5 mLs of medication 3 times a day. The bottle contains 150 mLs of medication. How many days will the medication last? So if they take 5 mLs 3 times a day, then 5 times 3 is 15. So 15 mLs in 1 whole day. And we want to know how many days can this medication last. So we're going to take 150, which that's the total amount of medication that we have, and divide it by this 15 mLs, because that's what we're giving out per day, and we're going to get 10 days. And this concludes our first segment of dosage calculation. There is definitely more to come after this. Just make sure you like, subscribe, drop a comment, and please follow me at Tutor Me Nurse RN on Instagram. Thank you.